Hey, everybody. So today we've been doing, or it's the first day of the 7-day autoimmune detox challenge in my Facebook group called the Tribe of Autoimmune Health Rebels. And if you're in that group, this is different. This is part of my episode for our podcast. We have a multi streaming option. I'm going live on my Facebook page as well as the groups that I host, as well as my YouTube. And then it's going to be going out as a podcast. Having said that, if you have not registered for the 7-day free workshop or 7-day detox challenge, then I want to encourage you to sign up. The link is below. Really come into our free Facebook group. And I will provide you with the opt-in link to sign up so that you can get daily emails where I give you specific things to eat every single day for the next 7 days, as well as the posture detox yoga, as well as meditation to detox your mind. So it's a very multifaceted approach, and it's what I believe that works. It's not just a linear approach doing and adapting a specific diet or doing yoga over here and getting a little bit of acupuncture over there. I'm all about using everything to connect the dots at the same time to amplify your health so you are able to address your mind, body, and spirit all at the same time. It's really healing you at the whole level. Having said that, this week's topic, I keep thinking about all the different holistic options that are available for us autoimmune patients or clients, what I like to call my patients, is that holistic health is becoming all the rage as patients are finding out the limitations of the conventional medical system. But dogmas and beliefs are hard to change. So many of us, myself included, for a long time, I was always seeking medical doctor up at the top of my hierarchy. And then I was seeking all the other things. And I really felt safe knowing that my rheumatologist was involved. And later on, as I got deeper and deeper in my experience with autoimmunity and gotten really, really sick, and then saw and experienced and witnessed the real limitations and understood then that they don't really understand and know the disease, that understanding something and knowing something is two different things. For example, if you have a broken bone, to know what it feels like to have a broken bone, you'd only know that if you had a broken bone, the rehab process, the pain, the dysfunctions that comes along with it, versus understanding the broken bone as an orthopedic surgeon and doing the surgical intervention and setting the patient on their way. It's two different approaches. They'll never know what it feels like to live with autoimmunity. Knowing that, I figured a long time ago that I needed to do what was right for me. And whatever approach that I take was not the right approach for some of my other patients. And I learned the power of individual complexities and then the genetic makeups. And really, that autoimmunity is a highly individualized situation and circumstance. And as such, every single one of us needs to be elevated in thinking differently about our condition and then become empowered by knowing what you need to know so that you can be the driver of health and then to truly embody health and wellness in your life. And being healthy and doing healthy are two different things. And so often, holistic health, in the name of holistic health, functional medical doctors, integrative medicine, alternative practitioners, you have to understand that they assume that they're the main driver of keeping you healthy. So it's a very different way to look at it. And I don't let anybody keep me healthy. Keeping myself healthy is my responsibility. And the moment I took that responsibility on, that changed everything for me. And now I'm the driver of my health. When I go see my doctors, I'm no longer subject to their care. I dictate and I share what I want to do for my body. And we have a dialogue. It's never the one-way street like it used to. I used to hang on to their every word and get really nervous. But now we have a dialogue because I understand my situation. I understand what I'm dealing with and I understand what I'm up against. and what I need to consider when I have to consider the medical care, like the medications, as opposed to my lifestyle that I'm in complete control over. So I'm able to really modulate and marry the two. And that's the sort of the elevated thinking, the empowerment, as well as the embodiment that I want you all to have and learn. And that's what our movement is all about. So, having said that, holistic health, like I said, are dogmas and beliefs. And because of in the name of holistic health, we still think medical doctor should manage our disease and health, right? And that's always been the case for so long. For me, that's what I used to believe is they're at the hierarchy at the top of the food chain, and it's whatever they say goes. But the truth is, they only understand pathology and disease processes, and they will only treat the disease. They don't help you with the health. And they only have an hour or so of nutritional education. So, health and wellness is far from their trade. What I want to clarify today is the difference between three different disciplines: the alternative, holistic medicine, as well as functional medicine, right? And why you must seek your inner wisdom to supplement your health, um, supplement your health promotions versus depending on the various experts who may understand your disease but don't really know how to guide you towards healing. Two different things. Treatments, sick care, and healthcare are two different things. So let's first differentiate between the three different disciplines. First is alternative medicine. Alternative medicines are any range of medical therapists that are not regarded as orthodox by the medical profession, the conventional medical profession, such as herbalism, homeopathy, acupuncture, traditional Chinese medicine, Ayurveda, chiropractic, etc. Functional medicine, on the other hand, is medical practice or treatments that focus on optimal functioning of the body and its organs, usually involving systems of holistic or alternative medicine. So they are very much open to the holistic and alternative medicine. It's what I'm trained in, and it's what I believe it's really lifestyle medicine. Third is integrative medicine. It's a form of medical therapy that combines practices and treatments from alternative medicine with conventional medicine. Do you see how everything sort of like meshed together, sound similar? That's where I'm like, okay, there's a lot of colleagues of mine, they're like, oh no, I'm an integrative medical professional. Oh no, I'm a functional medical practitioner. And over here, they've got like lump sum alternative care practitioners. Whatever that might be, I want you to never forget yourself as a common denominator. You're in charge. You're at the heart of this healing effort. They all should be promoting self-healing uh, capabilities within you, not to endow you with health, right? But to help you to heal yourself. It's really your work that you have to do, and you're just seeking their guide. At the end of the day, I personally got so sick and tired of various disciplines and confusing us patient consumers with different play on words. How are we supposed to know the difference between such similar entities? It gets to a point where not only are we supposed to educate ourselves on what to do for ourselves to promote health, but to educate myself on what I should seek. It just got too confusing. It becomes so much more dogmatic focus than really the problem, like my health, right? I want something that's going to help me and my health. That's it. I don't care what it's called and what they get hung up on. And there's so many different institutions and practitioners and labels that everybody gets so attached to. I don't care anything about that. All I cared about was, how do I help myself? And so at some point I had to like just stop the madness, pull away from it, really think about, what do I need to do every single day to create the health, right? Excuse me. There's a multitude of disciplines within the category of medicine, right? Because, it's not enough to have these alternative medicine, functional medicine, and then we've got integrative medicine. There's different uh, institutions that train, and then they have dogmatic viewpoints, right? They're all sort of segregated into their own, and it becomes all about them. But really, they're just yelling into or really kind of supporting the whole echo chamber of noise, so to speak. And it's creating a lot of confusion for us. And that's what I want to bring your attention to. There are multitudes of, for example, integrative medicine practitioners who do what they do, but frankly, they don't know what to call themselves as they bring conventional understandings to the holistic approach. Well, in my opinion, that's designed to fail because you've got both sides. And just because they're able to integrate, I don't know how that's supposed to help me to heal because it's a lifestyle, right? And like I said, knowing and doing and knowing and understanding something are two different things. Lastly, the functional medicine approach was just brilliant. But in my opinion, it's gotten so complicated because they dive so into the nitty gritty and they get down to the root cause of disease by checking all the labs. And in my opinion, it's to really validate the practitioner so much rather than the patient. In the name of patient care, they dive deep with the patients at the sake of patients' pocketbook because these tests are very expensive and it's something that gives us a lot of insights, but a lot of the times they're not necessary. I've had a big folder worth of functional medicine testing that I did over the last 10 decades or of last 10 years, and they've provided me with limited information to actually help me to heal myself in any way. And so it's not the first thing that I do. I do certainly think there is a time and the place for that, but it doesn't have to be so excessive. So, all in all, it's super important to remember that healing is your responsibility. We may seek help with our health from such practitioners of health, but their approach should not direct everything we do. Rather, we should be directing them on how they can help with our health endeavors. And that if they're not somehow aligned with our goals, then you need to think on your own terms or go get another practitioner that does align with what you want. These various medical approaches assume they know more than you about your health, but this is very much a misconception that I want to change for all of us with autoimmunity in our community. Take the power back. Learn the pillars of health, the principles of health, and why we developed intolerances to our own selves, which is essentially autoimmunity. And what we want to focus on is to create homeostasis and balance back into our bodies, not get lost in the name of holistic, alternative, functional approaches to different things. And we get so lost, and there's such a polarity, and there's a divide, and there's so much confusion out there that at some point you're going to find yourself overwhelmed by sheer volume of information that's out there that are often contradictory to one another. And if I'm being bluntly honest, I don't think these practitioners really truly understand autoimmunity. It really does boil me up inside when they try to tell me how to decide on my care. And it's just a soapbox for me. You can see and sense the frustration in my voice. I hope this was powerfully insightful for you. At the end of the day, I want you to never forget who's in charge here. You have to understand healthcare system is failing us. There is a biases. There's too many variables for us to truly understand what autoimmunity is. Nobody really understands. Just in the same way, nobody really understands COVID right now, right? We learned that medical community, medical system is completely confusing, or they are confused themselves, yet we're still left looking to them for direction. But I hope you guys see the deep entrenchments and interrelationship in the political arena with the medical system and how everything is coming together. And we're seeing it right before our eyes. Everything's collapsing. And it's time for us to really stand up for our own wellness and longevity and health, and really understand that this is something that we've got to take a cohort effort in getting our control back and the power back to really take responsibility for our own health. The moment you do that and you step into that power and stop depending on somebody else to determine exactly what you need to do and start being healthy right now versus being sick, wanting an intervention to get you healthy, waiting for that to happen, you've got to shift your thinking to be healthy right now, not do healthy by seeking another diet, a supplement, this or that that's outside of you, but you must start practicing truly being healthy right now. It's a complete upside down system in the way I want you to think about your health, because that is what's required right now for you to really win big in this very chaotic world where everything is promoting sickness, not health. And so I want you to fight for yourself. And right now, you guys, I am hosting a free 7-day autoimmune health detox challenge in my group where I teach you how to eat, how to move, and how to meditate to clear your mind. And I'm connecting all the dots for you. Forget all the dogmas, forget all the experts. How can I potentially really elevate the way you think so that you can be empowered to know exactly what you should be doing to really embody health and wellness in your life? Once you step into that role, boy, you guys, it's not scary anymore. It's no longer bound by anxiety and fear of unknowns with autoimmunity. It gives you that sense of power and control back. And once it's on you and take that responsibility, like anything's possible. And that's what I mean is autoimmunity is just a signal that your body is telling you that something is an imbalance. And yes, we need the medical sciences for us to get through the deep side of really disease management. But beyond that, beyond sick care, really the health care is really your responsibility, right? You need to clearly dictate, be in the driver's seat. And I want you to elevate yourself, empower yourself so that you fully embody health and wellness that you desire in your life, which you so deserve. And don't let anybody tell you it's incurable, and that's yours to decide what that looks like for you. So define health in a new way, step up your game, and really be healthy starting today. Don't get busy doing healthy. And that means just subjecting yourself to an experiment that everybody else tells you what to do. You adopt a diet for a short term, but it really doesn't really agree with you. You really have to be healthy. And that means healthy mind, body, and soul. Like you really need to be aligned with what vision you set for yourself. Really step into that power and be elevated, think differently, empower yourself with strategic alliances that you can set, and then to really embody health and wellness. Don't let anybody tell you differently. You've got this. You've got all of this, and I want to support you in every way I can. And that's what this group is all about. So join us. The link is below, and I will see you guys all next week. Just Lynn Mercer. Thank you so much, Lynn. There will be a replay page, so I highly recommend that you sign up. You guys, there will be a replay page. And if you don't like Facebook, I honor that because I don't like social media either. So negative and toxic. So we do have a replay page specifically designed. So I hope that that helps, Lynn. I want you to just binge watch it and really do the exercises and at least follow the diets, follow the movements. It's all to detoxify you, to amplify your health. And once you feel the difference, you're going to want to stick with it. But I emphasize heavily, it's not just about the doing. You have to be, you have to change the way you think about your health. You have to have an upside down approach. So I hope this was helpful, and I'll see you guys all soon. Thank you so much for your time, and let me know and say hello when you're in the group.